CT imaging, otherwise known as computerized tomography, is used in a variety of clinical diagnosis, treatment, and disease monitoring. Florida Hospital Waterman's Somatom computerized tomography is among the most advanced diagnostic imaging tools available. It produces a three-dimensional image by combining many X-ray images with the aid of a computer to generate a cross-section view or three-dimensional image of the inside of your body. It's also used to guide doctors during surgical procedures or treatments. A large donut-shaped X-ray machine or scanner takes X-ray images as many different angles around the body, which is recorded on a film. The recorded image is called a tomogram. Dr. Fred Wittenstein, radiologist with the Center for Medical Imaging, explains how the scanner will help doctors diagnose a variety of conditions quickly and with a lower dose of radiation.
This new scanner is much faster and much more powerful than any scanner we've ever had before. This will allow us to do patients much faster and get better detail and get better imaging and diagnosis of the patients. We get a fair amount of trauma patients coming in, and trauma patients, especially if they're unconscious and they can't tell you where it hurts, need to be scanned almost from head to toe. And so we can put a patient in the scanner and scan the head, neck, chest, abdomen, pelvis very quickly, process the images very fast, and get them to the radiologist to diagnose what's going on. Pediatric patients are a special issue, especially the young ones, because they can't understand or cooperate. They try, but they can't. And so being able to do a patient quickly makes pediatric work much better. And pediatric patients are more susceptible to any potential radiation issues because they're young and still growing. And so it's very important to keep the dose as low as possible. And this scanner has higher resolution, it can get pictures with lower dose, and it has special computer techniques for making the images that we can use lower dose overall. We think of CT scanners in terms of slices. So a CT scanner was one slice, and then it doubled to 2, and so on, 16, 32, and this one's 128 slices. And so it has a much wider range that it can scan a patient at one time, and it can freeze things that are moving. So we can freeze a beating heart now. CT scanning's become a go-to for cardiology evaluation, especially in patients that the type of problem they're having is questionable. If you're not sure if it's a cardiac issue, rather than waiting 24 or 48 hours for blood tests to come back, we can screen them with a CT scanner now and get an answer in a matter of minutes to an hour, as opposed to waiting 2 days. Having this scanner at Florida Hospital Waterman allows us to offer a wide range of equipment to our patients, and we can triage patients depending on their needs. Some patients can be done on any scanner, and some patients, especially heart patients, would be better off scanned on the high-speed new scanner.
For more information on the board-certified radiologists at the Center for Medical Imaging, or to find out more about their numerous imaging procedures, please click the CT Technology Story Link icon on our homepage at yourhometownhealth.com.